On November 10, 2024, a private medical team visited Borisana, a village in Gujarat. They set up a free health checkup camp, inviting local seniors for routine screening. The villagers trusted the doctors in white coats. They lined up patiently, handed over their government-issued Ayushman Bharat health cards, believing they were simply getting basic medical care. But behind the closed doors, the medical team wasn't trying to help anyone. Their real goal wasn't treatment. It was collecting health card details so they could later use them to claim government money. Within 48 hours, 19 villagers were taken by bus to a hospital in Ahmedabad. They were told they only needed few more tests. Instead, doctors created a fake medical emergency. The villagers were told they could die unless they underwent immediate heart surgery. 7 of them were taken into operating theatres and had heart stents implanted, and sadly for 2 of those villagers that surgery was fatal. Later, a government medical review team examined every case. The conclusion was clear. These villagers were healthy. They never needed angioplasty. They never needed surgery. Investigators say this is what happened in Khyati Hospital in Ahmedabad. For 2 innocent villagers, corporate greed cost them their lives. But this isn't just one hospital. And it isn't just one medical mistake. Investigators say this is a part of a highly organized multi-crore fraud where private hospitals turned India's largest public healthcare scheme into private cash machine. And according to the latest data, the government's own monitoring system left the door wide open. Ayushman Bharat was created to protect around 50 crore poor citizens. Eligible families receive up to 5 lakh rupees every year for hospital treatment. The idea is simple. Poor families get free healthcare. The government pays the hospital. But some private hospitals found another way to make money. They didn't wait for sick patients. They went looking for them. They traveled into villages, collected health cards, verified fingerprints, and turned government benefits into business. Investigative units have exposed other 3 shocking ways hospital tricks the system. First, upcoding. This means treating a minor problem but billing the government for a massive surgery. A patient walks in with a mild viral fever or a simple knee pain, but the hospital logs it into the government computer as a complex total knee replacement surgery to claim lakhs of rupees. Second, the ICU photo mirror. ICU beds pay the highest rates. To cheat the system, anti-fraud teams caught hospitals taking a single photo of one genuinely sick patient in an ICU bed and using that exact same photo for dozens of entirely different fake claims, simply changing the names on the screen. Third, AI-generated medical records. According to the National Health Authority updates released in May 2026, fraud has become high-tech. Hospital staff allegedly used generative AI to create fake medical notes, forge doctor signatures, remove digital watermarks, and even fabricate laboratory reports. If an expensive treatment required abnormal test results, AI could generate those numbers within seconds. The biggest question is obvious. Where was the government while all of this was happening? How did thousands of fake procedures move through an official system without anyone noticing it? The uncomfortable answer is simple. The system was built, but the back door was never properly logged. When the Comptroller and Auditor General, the CAG, audited the database, the findings exposed major structural failures. Investigators found 7.49 lakh different beneficiaries registered using the exact same mobile number. That meant security alerts, verification messages, and fraud warnings went nowhere. The software had another serious flaw. It approved claims for surgeries that supposedly happened after patients had already been discharged. In thousands of documented cases, the system even cleared payments for patients who had already been recorded as deceased. The system made one critical mistake. It paid first and checked later. By the time the fraud investigations began, the money was already gone. To tackle the problem, the National Health Authority introduced new AI-based fraud detection tools in May 2026. The government says the system has already produced major results. More than 630 crores in suspicious claims blocked. More than 1,100 private hospitals were blacklisted and hundreds more placed under investigation. And the financial penalties crossing 122 crores. Those numbers sound impressive, but then investigators carried out a surprise inspection and the result told a very different story. One hospital claimed 592 patients were admitted under Ayushman Bharat scheme. When inspector walked through the wards, they counted only 40 people. Another hospital reported 9 admitted patients. Inspectors found just one, because computers only analyze the information hospitals upload. Algorithms cannot walk through hospital corridors. They cannot count beds. They cannot see patients. They can secure paperwork, but they cannot monitor what actually happens inside a hospital. So what happens when these medical rackets are finally exposed? In the Khyati Hospital case, police arrested hospital management and the cardiologist. They filed serious criminal charges including homicide. Investigators alleged that medical records had been altered. A fake emergency was allegedly created to justify a profitable surgery. The legal process did not end there. In May 2025, the Gujarat High Court rejected the doctor's first bail request. Months later, after a fresh bail application, the doctor was granted bail. The Gujarat government challenged that decision before the Supreme Court. But in February 2026, the Supreme Court declined to cancel the bail. The doctors remain out on bail. While the criminal trial continues, the allegations have not yet been decided by the trial court. And that brings us to the real problem. The government built a healthcare system that sends public money to private hospitals, but it relied on digital portals instead of a continuous ground level human oversight. An AI system can detect a suspicious PDF after it is uploaded. It cannot stop someone from creating fake records in the first place. The government is trying to code its way out of a crisis, but software alone cannot replace human oversight. And until that changes, the next scam may already be happening.